According to the Centers for Disease Control, so far this season, there have been at least 6.2 million illnesses, 53,000 hospitalizations, and 2,900 deaths when it comes to the flu. Our local hospitals are seeing a lot of patients as well. Dr. Jeff Johnson's an emergency room physician at Hillcrest Medical Center, and he's here to tell us more about what they've been seeing, especially as of late. Good morning.
Good morning.
Are we seeing those numbers like we're seeing on the national level here?
Yeah, we're seeing a lot of flu right now in the ERs kind of throughout the area.
What are some of the issues that when people come to you that they've been complaining about?
Really the symptoms of flu are fever, chills, body aches, cough, congestion, sore throat. Then with the flu, you can also get kind of the GI symptoms, so vomiting and diarrhea as well. A
lot of times those symptoms are very similar to what we've experienced with COVID. How can you tell the difference?
It's tough because the symptoms are going to be pretty similar. Kind of the difference that we've always seen with COVID is that loss of taste, of sense of taste and smell, which you really don't lose with the flu virus.
So that's, once you start to kind of notice those symptoms, what should you do?
So if you get tested early, you can start kind of antiviral, anti-flu therapies. They are available. If you or your doctor recommend that, then you can start those, but they need to be started within about 48 hours of onset of your symptoms.
A lot of people wait till the last minute and just show up at the ER. What do you recommend instead?
If you can go see your primary care doctor, maybe an urgent care, if you have any at-home testing, if that's available to you, those would be options as well.
When it comes to getting our vaccines, we hear about the season, you know, starting usually in October, all the way through, how long does the flu season usually last?
It depends. Sometimes it starts early like this year, sometimes it lasts a little later, so it can go all the way until spring.
How effective, I guess, is the flu shot this year?
Seems to be really effective. We've seen some numbers recently where the people who've been coming in and testing positive that we've had records on have not had the flu shot.
Well, and a lot of times, you know, it won't necessarily prevent you from ever having the flu, but it does lessen the symptoms?
Yeah, it really lessens the likelihood you're going to get it, first and foremost, and if you did get it, you probably have less symptoms.
I know that we've been gathering for Thanksgiving, we'll be gathering for Christmas. What are kind of some of the precautions, or what do you recommend moving forward?
If you're sick, you know, you need to stay home, and if you have the flu, you probably won't feel like getting out anyway, but you know, really, if you've had fever, you need to wait about 48 hours after you're fever-free before you get back out and go to your holiday gatherings.
How have you seen an increase since Thanksgiving? Is that even, because sometimes you think we stay at home and then all of a sudden you get these big gatherings, or I know people have gone to big football games,
Sure.
They've gone to big events, and then afterwards they start to notice problems.
Yeah, I'm sure that's caused an uptick in the cases. It kind of felt like we were kind of steadily building anyway. So, but yeah, I'm sure just being around people, it's a very contagious virus. So, you know, just being in close quarters with people is going to increase the likelihood you're going to spread it or get it.
The COVID situation has settled down a little bit?
Yeah, we're still seeing a few kind of sporadic COVID positive cases. They're still out there, but certainly the numbers have been lower. Hospitalizations have been much lower recently.
I know you've been incredibly busy between the flu, RSV for the little ones,
Right.
A lot of issues out there. So I know that people are very important to protect themselves, to make sure if they are feeling poorly, not to expose.
Correct.
All right. Great to see you. Thank you for coming in. We appreciate it. And
Thank you.
Thank you for what you do.